What is going on, busy bariatrics? Let's finish this series with one of the biggest concerns patients have. Will I regain weight after bariatric surgery? The short answer is it can absolutely happen, but there are clear ways to prevent it, and that's what we're going to cover today. Regain usually comes down to two factors: changes in anatomy and changes in behavior. Over time, your stomach can stretch a little, and hunger hormones may increase again. But the bigger driver is going to be behavior, slipping back into old eating habits, grazing, drinking calories, or avoiding exercise. It doesn't happen overnight, it happens gradually, and that's why awareness is key. There are some early red flags, though, that you should be mindful of. If your weight starts to creep up roughly more than 5 to 10 pounds, and obviously that's going to change based on your height, your weight, your age, and everything else, but if you notice an overall trend in the direction, be aware of that. We've also seen from a lot of studies that skipping protein and relying on slider foods, as well as skipping meals, are key factors causing regain, as well as missing vitamins or follow-up visits with your surgical team because you're coming out of the rhythm of doing the work of weight loss surgery. Also, using alcohol or snacks as comfort instead of fuel can sometimes cause these issues. The good news is, though, catching these signs early make it much easier to course correct. There are some proven strategies also that can help you protect your results long term. The first is going to be protein first. Build every meal around it, and then I'd even add an extra caveat of produce second. If those are the first two things on your bariatric plate, you're already moving in the right direction. Second, track when needed. Food logs do help spot patterns before they spiral and make sure it's an accurate tracker. Third, make sure you're strength training. The more that you have muscle built onto your frame, it's going to keep your metabolism working for you during all reasons and seasons of life. Make sure that you're following through with your routine follow-ups, and make sure that you see your bariatric team at least yearly, even if you feel fine. Finally, having a level of community support, whether it's groups, coaching with us, or check-ins to keep you accountable, make sure that you keep your head in the game well after the feelings and restriction of weight loss surgery end. If regain does happen, it's not necessarily failure, but it is feedback. You want to reach out early, and we are more than available to help. Some patients benefit from medications like GLP-1s, behavior coaching, which we do, or in rare cases, even revision surgery. The key is not waiting until 20 or 30 pounds have crept back before acting. You need to remember that surgery is not the finish line, it's actually the starting block. Regain is absolutely possible, but it is not inevitable. With the right habits and follow-up, though, you can keep your results for life. So if you're worried about weight regain, remember, it's something you can prevent with consistency and accountability, and by reaching out to us, or at least checking all the other free resources, guides, and materials we offer on this page. If this did help, subscribe, share this playlist with someone starting their journey, and let's keep getting busy.